to welcome all of us, and I wish you a happy new year. This is our first interaction in 2019. So we last talked last year, so it's a pleasure that we are talking again in the new year. So, and I want to congratulate all of us for last year and what we were able to accomplish. This year presents us new opportunities, and with the kind of vigilance, with the kind of enthusiasm that we exhibited last year, I have no reasons whatsoever to doubt as to whether this year will be great. It will definitely be great with all of us together, working together as a team. There is an assignment which is very critical, which is the co-planning, which is ongoing. And as far as I understand, the country engagements are, I think, ending this week or somewhere early next week. So if there is anything you yet have to do in terms of getting your action plans captured within your country operation plan, the moment is now. So I appeal to all the country team members. You remember the work we worked on in Uganda, and the one and which we also polished up in Abuja. We may make sure that we are able to find funding eventually to implement our action plans. Of course, we concentrated on demand creation and results utilization, but of course that is not the only need for your program. So as you consider the other bits, but make sure these particular two are properly captured, because we would want to see us making progress in these areas, which we agreed all of us while in Uganda that they are challenging. Then we will need you to send us your final action plan that you've been working on or you've been working with now. Please make sure you send us whatever you have now, as of now. By next week, make sure we have your plan so that we can also have it on record. And then as we also try to monitor and support you and whatever, we can be referring to that particular plan that you sent us. So all country teams, please, we agreed while in Abuja that you will be sending your final plan by end of second week of Jan. We are now at the very end of the month. So can we make sure that we have our action plans sent before we end this month? Because we have about a day or two to do that. So that next month, we begin, we leave this action planning bit behind us when we have already submitted our action plans. Then we can begin thinking of the implementation, the monitoring that will have to go along. If you need any support, we are open. You can always reach us and ask us anything that you need us to support with. But otherwise, we are looking forward to getting your plans funded. And the chief, I'm happy that on this call, we have the laboratory chief for each of the countries that are LabCoP members. All of you have been invited to this call, and I want to thank Luti and team for actually opening it up to the rest of those people. Please make sure you help your country teams, your country plan to ensure that the action plans that have been developed are captured within the country operation plan so that they can be funded. Otherwise, I take the pleasure today to introduce our presenter, who is Dr. Ritu from the International Laboratory Branch, CDC Atlanta, who is going to be presenting the innovative public-private partnership for laboratory system strengthening as we scale up viral load to meet the targets We are quickly pacing to 2020, barely 1 year to go. So we must do whatever we need to do within the remaining time to ensure that we are able to catch up and meet the targets. And the public-private partnerships are very critical, and we are delighted to have that as our presentation for this session. So, Dr. Ruti, you are welcome to take us for the next 20-25 minutes.
Thank you, Charles. Thank you very much. Just let me ask everybody who is not speaking, please mute. And my name is Ritu Shrivastava, and I am the coordinator for public-private partnerships, as Charles just said. And I will be speaking on the innovative public-private partnership for global lab system strengthening to accelerate epidemic control. So my presentation outline is I will be speaking about the UNAIDS 1990 Global Treatment Goal by 2020. And then what is the role of the 3 lab-focused public-private partnerships and the opportunities for PPPs to scale up viral load EID. And at the end, really, how can you benefit? So most of you are familiar, actually all of you on the call are familiar with the PEPFAR strategy and core agenda. And I actually really don't need to define epidemic control. All of us are working for it. By 2020, the PEPFAR strategy says we need to reach epidemic control in 13 out of the 50 countries for all ages, genders, and at-risk groups. And here in the PEPFAR strategy, among the various core strategies, we see partnership as one of the key strategies. And this is again stressing that individuals win battles, but partnerships win wars. And really, a government cannot do it alone. We will need the private sector, the philanthropy, the multilateral institutions, civil societies, and faith communities to come together to meet the HIV/AIDS epidemic control goals. So here are the UNAIDS 1990 treatment targets to be met by 2020. The first 90% of people living with HIV know their status. Of these, 90% diagnosed receive sustained treatment. And of these, 90% of people receiving treatment have durable viral load suppression. So in the words of Steve Jobs, innovation distinguishes between a leader and a follower. So here are the public-private partnerships as tools for innovation at the International Lab Branch. We have Siemens Healthineers working towards the first 90 majorly, the Becton Dickinson and Company working towards the second 90, and the Roche Diagnostics working towards third 90. And today I will take you on a journey on how these public-private partnerships are majorly working in these 3 90s. The core of public-private partnerships to strengthen lab systems is through the systems, which are divided into 7, the quality management system, the work development, biosafety and equipment maintenance, supply chain management, lab information systems, sample referral systems, and the policies of the country. And to be able to have a stronger and sustainable health systems, regardless of the tests that we are doing, all of these systems must be strengthened to have a sustainable health system. So the mode of operation of the 3 labs strengthening public-private partnerships, Labs for Life, or the PPP with Becton Dickinson and Company, They sent volunteers, these are experts in their field, to the countries. The Roche PEPFAR public-private partnership offers a didactic training center, which is the Roche Scientific Center at Johannesburg, and now it offers an online platform. The Stronger Together, which is the name given to the Siemens Healthineers, operates through an e-learning technology via online platform and videos. And we will be learning a little more about these platforms and what it can do. This is something that is offered for free to us, and it is really like a Facebook of the lab world. So just a little bit about the first 90 coming for the Siemens Healthineers. This is a PPP that started on the request of Senator in Delaware. And along the way, by 2018, together we produced a rapid testing continuous quality improvement e-tool, which is a competency assessment tool for HIV test providers. And they also completed a quality control and method validation e-tool, which is a set of 48 online videos, job aids, a lot of things all into one package. So still on the first 90, the rapid testing continuous quality improvement. We know that the problem is that just in 2017, we tested about 85 million tests, but even if 1% of them are misdiagnosed, we have about 850,000 people misdiagnosed. And really, there are very few methods to ascertain the competency of HIV test providers. With that in mind, there is an online refresher training video. You will find it at this link to assess the competency of the people who are providing the tests. And this is a page which I put together for you, where the refresher training course for HIV testers, then this is the competency assessment test. And this will also provide you with a certificate. It is a Siemens certificate as of now. So, and we will go to these pages in the end, should time allow us. And I believe Siemens and other partners should be on the call if you have any questions. They were invited. So I think you should be able to ask them some questions. The next is the quality control and method validation video. Okay, so just a couple of things. Zambia, they have just finished their certification framework, which is approved, and probably going through the PEP Connect training as we speak. So to this tool, which is the competency assessment tool, this is what the leadership of the Division of Global HIV and TB had to say about it, because of its potential to revolutionize certification of lab workforce beyond HIV. Stronger Together PPP is seen as a best practice. So I am hoping you will be able to click on the link and use the refresher training video and the competency assessment test. So now coming on to the quality control and method validation online tools, also by Siemens Healthineers. So QC, the quality control and the method validation, mostly the method validation, is mostly poorly understood and practiced because of its statistical awareness that is required of the users. So, which leads to poorly established quality control, causing erroneous results. And this leads to an inability to justify resources necessary for CDC programs to support accreditation. And this is why this video is important. And this is really Anna Murphy, the consultant who has stuck in all the 90 days, 9-day certification program for lab technicians, all into these set of 48 online videos. I should be able to show you that link in the end, but if you're trying, go to this link. So now coming on to the second, the Becton Dickinson public-private partnerships, which we are calling Labs for Life. And here are some goals for Labs for Life, which is increasing lab human resources capacity building and training, improve lab quality management systems, and also leading into TB diagnostics and strengthening local capacity while doing all of the above to improve country ownership and sustainability. Some of the key milestones for Becton Dickinson or Labs for Life started in phase 1 with the 5-year memorandum of understanding. In phase 2, we did a program evaluation and won the ASLM Best Practice Award. It was Ambassador Gooseby who launched the next phase at IAS. In 2016, we were able to publish a Labs for Life supplement. It is an entire supplement, which you should be able to pull up. I will have a link for it. And there you will find what is a PPP and how you would like to go about it. And in the third phase, around 2018 to 2021, the third MOU has been signed, and they have been able to accreditate Kenya's Kikuyu lab in a very short span of time. And this is a photo of the Labs for Life, the journal that I was speaking to, and this is the link. And here is a celebration of the relationship between PEPFAR and Labs for Life. Here you can see some of the key results, which you will also find in the supplement that I just spoke about. But the key being reducing the turnaround time to provide results to the end users, pretty much reducing it by 50%, and reducing the amount of time by 94% that it takes for a specimen to reach the lab. So moving on, in phase 2, there were about 41 labs supported by Labs for Life in all of these countries. This is for SLAMTA and SLIPTA. And in phase 3, 2 new countries have been added, which are Haiti and Rwanda. So now, moving on to the online biosafety tools, which was a HOP-funded activity for the public-private partnership funds. The problem was observed when one of the biosafety official was traveling to, from ILB was traveling to Botswana, and one of the doctors was describing an incident that how the blood of an HIV patient splashed on the doctor, and they really did not have a guideline on how to protect the people who are being splashed. And it really turns out that people, especially people who are speaking languages other than English, have very little access to safety guidelines. With that in mind, the biosafety team at the International Lab Branch has made courses available for the auxiliary staff, for the clinician staff, and they're working on a course for lab staff as well, and it can be found at this link. We will go to that link if time permits in the end. So now coming on to the third 90, which is the dry blood spots for early infant diagnosis and viral load specimen collection. And I am showing this page of ASLM, and I have circled resources so that you know that's where you need to go. Sometimes this page will show, oops, the content is not available. Don't worry about it. Just go to the resource center and click on the viral load tools. Viral load scale-up tools. And this particular video for specimen collection using dried blood spots for viral load and EID is also available at other sites. And we did this in collaboration with the Maternal and Child Health Branch at the US CDC. And this video is available over here at the ASLM website. You can click on this link. So let me go on to the next. So over here, I have the very familiar viral load cascade. And the elements in the pre-analytical phase are the demand creation for testing, specimen collection and processing, and specimen transport system. In the analytical phase, we have the lab testing. And in the post-analytical phase, we have the result reporting and interpretation by clinician to use those results for patient management. Now, the challenges in these phases are lack of awareness of test offering, non-standardized collection practices, the weak transportation system. There is also frequent equipment breakdown and weak supply chain, and delayed, inconsistent delivery of test results, and limited data management systems. And to top it all, there is inadequate and incompetent workforce. And who else would know that better than you all? So now, what does the public-private partnership offer to take care of the system strengthening within the viral load cascade? So the Global Access Program, this is the program, the PPP, through which you got the cost reduction for viral load testing. Now it's at between $10 to $14. That was a PPP. I have already spoken about the Roche specimen collection video using the dried blood spots, and riders for health. So the red over here signifies that these are non-PEPFAR public-private partnerships, and the blue ones have a PEPFAR global partnership. So the Riders for Health is a public-private partnership that started in the UK, and it continues in Africa, in sub-Saharan Africa, with about 1,300 motorcycles. And these riders go to the communities and actually collect specimens and deliver results, especially in remote areas where very few people, health services are able to penetrate. Turnkey Labs is also a Roche initiative, a public-private partnership that started because in 2008, only about 12% of the babies were getting tested for EID within first 2 months of their age. And Turnkey Lab provided solutions of EID labs in several places. That's where they started EID PCR to begin with. Abbott Fund. So Abbott Fund is a very well-known PPP in Tanzania. And if there are some Tanzanians on the line, they can vouch for that, who have spent huge amount of money, not just to fortify the national reference lab, but they've also picked up 21 or more now district level labs. And through that, they have improved a lot of systems and the equipments and workforce, not just for the communicable diseases, but for the non-communicable diseases as well. The Phones for Health, I do know Kenya is using this, Phones for Health, where the companies have Motorola and other companies combined with the clinics, and the results are sent via a phone, and a SMS printer is attached to the phone on the other end of the clinics, where the results can be printed directly off of the phone. These results simultaneously go to the end user as well. So now there is one more. These are the drones that are being used through companies of Zipline and Matternet. And I know now that with the FIAs, there is a lot of issues collecting specimens from very hard to reach areas. two companies are working, and I definitely know Rwanda is one of those. Probably Tanzania as well, but Tanzanians can tell me some more. You will find the details of all of this in this link below, BMC Health Services Research, and please click on this link to find more details of how you can benefit from these public-private partnerships. And here is my acknowledgement to the ASLM LabCoP team, the private sector teams, and I believe some of them should be on the call. And of course, my team members, the in-country Labs for Life PPP teams, and formerly ILB, but now Africa CDC, John Kengasang. This was, PPPs was his ideas to begin with. So how you can benefit, this is a take-home message, offer and share the free state-of-the-art links and platforms to Ministry of Health and program planners, partners, implementers from any organization for program improvement. So Charles, do I have the time to go to these tools? I can't hear you, Charles.
Oh, sorry. I think
Yeah.
I'm on mute.
So
okay, I have like 5 minutes. You think you can flash just to show them the pages in 5 minutes?
Yes, I can do that. Thank you. Okay,
that, yeah.
Let's try that. So I have opened these tools for you. All right. So this is the PEPFAR. Okay, all right. Just a minute. This is a new share. So are you able to see the Siemens Healthineers? Okay. The PEPFAR rapid HIV test continuous quality improvement. So, and the platform is called PEP, the Personalized Education Plan. And this is the refresher training online video for the HIV rapid test provider. And this is the continuous quality improvement assessment plan. And countries who have gone through the approved certification can definitely use the video and the test to generate a score. So now let me go to the next one. So here is the ASLM website that I was speaking about. And this is the resource center where it will be loaded, the 3 videos in English, French, and Portuguese. And go to the viral load scale up tools. And as you scroll down, so this page takes a little bit to load because it is loading 6 videos. So be patient with this page, it'll load up. So here's the English, French, and Portuguese version of the dried blood spots. And this is the EID version for collecting specimens using dried blood spots in English, French, and are you able to see that?
Yeah.
Okay. So now let me go to another share. So I was going to show you the biosafety one. So this is now on the Slamta. Are you able to see it?
No.
Okay, not yet. All right. Give me a minute. Are you able to see it now?
No, did you click on it?
I did.
You need maybe to go down there and where they are listed, and you click on it.
All righty, now.
Okay.
Are you able to see the biosafety one? Okay.
Yeah.
So this is the entire website for the biosafety program. And these are the resources. When you first begin, you will have to register on this site and then click on the safety courses for African healthcare workers. And this is where you would register. And these are the job aids. And these are the various videos. Let's see if I can play one.
Oh. So is that the last share?
Yes.
Okay.
So you get the idea.
Yeah. Okay.
All righty.
Okay. Yes, Ruth, thank you very, very much. I think this has been momentous, and people have been glued to the screen. I know they have some reactions to the presentation. So thank you very much. Nicholas has been monitoring the chat. I know there could be some questions on there, but even before, if you haven't done that, you can put up your hand. You'll be picked on to provide any feedback, any reaction of whatever sort. So Nicholas, you have questions to read out?
No, there are no questions in the chat.
Okay.
Okay, we have one from Layberry, and she's saying, with regards to the funds for health program, it was mentioned that the result was given to the facility and also to the end user. Do you mean the patient? If so, how do you overcome protection of personal information? I think the question is about confidentiality.
Okay.
Yeah.
Maybe I can also ask, apart from the tools that you find on the ASLM website, the other tools like the Siemens and this other one, which website is that? I think people need to understand how to get to those. Why can't they create a link between the ASLM website and these websites, so that there's one shopping center where somebody goes and they can be led to the next door, so that people don't have to run up and down on different websites picking different things, and they may get confused, because I imagine those websites have got so many other things.
Yes.
And if somebody goes in for something specific, should not be lost in a lot of other stuff. Is there a link, or can it be developed between this website and the ASLM website?
Thank you, Charles. I take it there are no more questions and that I can answer?
Yeah, you answer. If there is any, we shall bring it up.
Okay. So let me take your question first, Charles, which was more of a excellent suggestion. We as an international lab branch would definitely like to put up all these links on the ASLM website. so that they can link to the sites, let's say to the Siemens site, or to the Roche learning management system. So if that is possible, we would like to take that next step so that it becomes easier for the people to locate these training tools.
Okay.
So just a word for Siemens Healthcare, which is the personalized education plan. This is not just the videos. This is a total platform where countries can actually upload their own videos, their own SOPs, their own guidelines, and they can form their own groups like they do in Facebook. And only the people who are on the group leader, will be able to see the scores of the competency assessment tests. So in a country, you could do as many you like, as many groups as you like. This link is also shareable by phone. So if you like, you can look at your phone or send the link or the tests to somebody by a phone. So pretty useful. And plus Siemens has a lot, about hundreds of other videos as well, which are state of the art. And some of it you could take a look and see if they benefit you. Now, for the second Phones for Health question, this is a very country-owned algorithm. Like I said, Phones for Health is not where PEPFAR has been involved. That was the blue in the chart. And this is a results of a review manuscript, which is published. So I was sharing the results of the review, but really the country will decide how they want to run it. Thank you.
Okay.
We also have another question from the chat. It's from Adisu from Ethiopia. He is saying concerning the public-private partnerships, is there a cost implications for the services from private facilities? Is there any experience on this? And then he is saying that for the case of Ethiopia, in the public facilities, patients don't pay, but in the private facilities, they are expected to pay for the case of Ethiopia. So.
I am trying to understand the question. So there are two parts to the question. One is about the PPP and the other is about the services offered in the private sector in Ethiopia, correct?
Yeah, sure. I think he's asking the question basing on their current state in Ethiopia.
Right. So Ethiopia has Labs for Life public-private partnership with Becton Dickinson. They have had it for about 10 years, I think. And Ginu Kebere was there, and now Yared is there. And there is, the short answer to that is just go to this journal, and you will find a lot of the things on how to develop a PPP and some of our experiences from 10 years on what to do and what are the challenges when you want to develop a public-private partnerships. Now, these examples are of global public-private partnerships, but if you want to do a local public-private partnerships, that is very much encouraged. Look around your area for companies like even Coca-Cola and the diamond industries, they all have corporate social responsibilities and are willing to do this, but you have to do your due diligence first. That is the company really looking to promote their own goals, or are they looking to promote the common goals of the Ministry of Health? That is the key thing that you want to look for when doing a local public-private partnership. So regarding the services, which is the second part of Ethiopia's question, I am not very clear on the question, so I'm not able to answer it right now.
Okay. Yeah, for these global partnerships, are they purely public corporate social responsibility, or they are being funded. And when they come to operate in countries, do they come with their agenda, or they build into the national plan? How do they? Yeah.
So thank you so much for that question, Charles. The way these needs are addressed, or the unmet needs in the country are addressed, are that they work to find out the needs from the National Lab Strategic Plan. And there is usually a CDC person in the country who understands the needs, and the in-country CDC lab advisor and the private sector representative go to the Ministry of Health and say, okay, we see 7 needs, and out of these 2 we are able to do it. So the request or the understanding is that it should be a match in terms of resources, not necessarily money, but in resources of what the country is bringing and what the company is bringing. The country has a lot of advantages, that they have the building, they have the electricity, the water, the people. So those are all resources that they're bringing in. And the company would bring e-platforms, or they would bring people, like how Becton Dickinson does. They understand the needs, like say for Becton Dickinson, they understand the needs, and they will go back to their country, advertise for these people, the experts. Let's say the lead is continuous quality improvement of a lab. So they will advertise for these people so that they can pick these people from their own pool. And then and sometimes even we as an international lab branch go to New Jersey, which is the headquarters of Becton Dickinson, we train them. And then these people come to the country. So really, it's a whole cycle of understanding what the need is, and it comes from the National Lab Strategic Plan and matching of the resources.
There is another question from the chat. It's from Nola Vere from Zimbabwe, and she's saying, as a country, Zimbabwe has benefited on the public-private partnerships for the Roche Global Access Program, but not so much on the other initiatives. They would love to explore the Siemens program for competence, and they are saying that please do share the phone links and any associated costs, I think, for the Siemens program. And then this is a reminder to everyone in the group, kindly feel free to raise up your hand and give your country experience or any comment or question. Thank you.
So thank you for that question from Zimbabwe for the funding. So as of now, as you know, PEPFAR is moving towards all the programs building sustainability in the countries. So global public-private partnerships, these will continue, but the new ones, we are asking the countries to approach the private, to look into the options of local public-private partnerships, just as Tanzania has done with Abbott Fund. Is there funds for it? Now, just as I was saying, the way you would match up is the existing funds and resources. You have resources in your COP, maybe for RTCQI, maybe for viral load, and maybe for EID, and maybe for SLAMTA. And if that's your need, you say these are our resources and funds. And how much can you, private sector, can you put it in your corporate social responsibility? That's the model. But there is a lot of due diligence that is required to start a public-private partnerships, and perhaps OGAC and we as an international lab branch should be able to help you on how to start a public-private partnership. I know George LMG is on the call. Thank you. But it's not easy to start those discussions. But once you set as to the goals that both the private sector and the public sector are trying to meet are common, then the ball sets rolling. Otherwise, there is a lot of conflict of interests, and you have to address that in the beginning.
Yeah, how is that addressed? Because of course, that conflict of interest, assuming you have this vendor who has been tapping, I mean, whose services you've been using, and you feel you're stuck, you need them to help you, and then they tell you conflict of interest. We have very stringent regulations. We are not supposed to do X and Y. So how do you, what is there a toolkit that breaks this down into real operations? How do we deal with that whole thing of conflict of interest?
Yes, that is a very good question, Charles. You're asking all the brilliant questions. There is definitely a toolkit and a training. We have used toolkits from Cardinal, and actually I can send that link out to you, Charles. And it is also included in one of the latest manuscripts that I showed to you, probably. So, but I'll send you that link again as to what those tools are on how to form a public-private partnerships. And it is on the Cardno website. We have also used them for our evaluation of the public-private partnership.
Good. I'll be happy to receive the links or the tools so that I can also share with the community members. Otherwise, they are very critical. We really need to build, you know, to fend for support of our programs beyond PEPFAR and these global donors, so that they can bridge a few gaps within our programs. That will be very handy. So do we have any further reactions? We have a few, we have a few, like 5 minutes to go, which you can use to actually, if you have a question, if you have any clarifications that you need from Ruti before, or you want to share an experience. Okay, so if there isn't, I can. I know it's relatively a new field, and I think that's why we don't seem to have. We are used to things being processed out for us, and we find them done already. But I think it is high time we start being more proactive and engage. When you look at the funding frameworks and the landscape, we really need to be more proactive. Otherwise, our programs get stuck because the envelopes keep reducing and yet the needs keep growing. So we must find several ways to actually bridge up the gaps. And I think public-private partnerships are very key, are very critical, and this presentation has been very timely for us as programmers to think of creating partnerships and collaborations that help us to advance our agenda. And the private-public is a very strategic one. It's mutual. Both ends benefit in all this, because the private corporates want the services for us to consume them, and for us to consume the services, there are certain things. So there's mutual interest. And if we get the techniques of doing this, I think we will be we will reach out more and talk to our corporates, talk to some of these agencies that are out there to come and give a hand into what we do routinely and what we struggle to do with their help. So we are happy about the links which have been shared, and this presentation will be made available on the website. I think the links are already active. When you click on those links that are on the last slides. They open, not so? Litu, I'm asking. The links
yes,
are active.
they do. They are active, but you would,
Okay.
when you are a first-time user, you will have to log in. So create that login.
Okay, okay. So we should go in there and get to know more information. And then there was that infectious journal. Is it also on the website where you said it has, you know, the guidelines on how to form a private-public partnership? I saw it in a hard form, the one which you flashed.
Right. This the link is available to you on the presentation.
Okay.
I put on the last page. I put this link positively.
Yeah. Thank you, because that is very, very helpful. That you're giving us this information and where to get more information. And if we have more questions, the questions, you know, before we internalize, we may not be able to ask a lot of questions, but when we go to seek more information or go to these sites, we may generate a few more questions. So keep active on WhatsApp. It is our very engaging platform where we keep discussing. So we ask you members to keep sharing your experiences around public-private partnerships. And also, if you have any questions, keep asking. But all of us, all these private companies that sell to us the reagents and they give us their technologies and whatever, they have a mutual interest of trying to see that our programs are running. And for that to happen, we might be having a few things that are stagnating our program, and they would be happy to give a hand because they are beneficiaries. If we cannot move our samples from wherever they are supposed to come to be tested on their machines, also their reagents will not be used. So if you told them, help me to find a way to move the samples to where the lab is, they might be happy to do that. Only we just need to learn techniques on how to navigate around this conflict of interest and all those stringent whatever guidelines around how these companies can be of support to national programs. So thank you very much. Since there are no more questions, I want to make a few announcements. Okay, I want to make a few announcements. The announcements are, of course, I began with this, that we are now in a critical time of co-planning. And we are appealing to country teams to take advantage of the moment and make sure that our action plans are reflected within the country operation plan. This is very critical because we did not do these plans just for them, for the sake. We did them to implement them. And we would want to see that implementation happen and the funding moments, lobbying for funding is now. So make sure within the next few days, if there is anything that has not been done, please reach out and make sure that your country team, the PEPFAR team, the program, the ministries of health, and whoever else is a player, key player within that framework is reached out to, and highlight your needs and make sure they are captured within the country operation plan. I know the chiefs from countries, laboratory chiefs have been on this call. We appeal to you to support the country team, country teams to ensure that their action plans are captured within the country operation plan. As I began, we expect your final plan by end of this week. We need your plan with us. The one that you're finalized with, you just send it the way it is to us, and then we can continue the discussion and we can continue the support and engagement that we may need to continue doing with you and with your stakeholders to ensure that your plan is actualized. Otherwise, the month has ended and we had committed ourselves that we shall end, we shall have submitted our action plans, the final ones, before end of this month. So please make sure you do that. Gesh, you have put up your hand. You want to say something?
Yeah, I just want to underline what you've said, because you sent a message on, I think you can hear me, right? You sent a message. You sent a message on WhatsApp regarding the country strategies of including their action plan in their COP. So that would be appreciated if countries can share their strategy and their approach of including their action plan in the COP. That's one thing. And the other thing regarding the action plan, if they can send this week, we can work on the common indicators to monitor the implementation of those action plans. So after some time, probably you would share the common indicators for measuring and monitoring the implementation of the project. So it's very critical and high time to share their strategy, best practices on including the action plan in the COP, as well as sharing the final version of their action plan.
Okay. Is Dr. Pasco online? Probably not. So let us continue the discussion on WhatsApp. And let us, I saw there was a wrong message that was sent on WhatsApp and somebody apologized. Let us make sure that you only send relevant information on the group, which is pertinent to the rest of the country members. It was a mistake that I think a child played and sent a political message on WhatsApp. But we really understand, we know that was done in error, but we try to make sure we send critical information, things that pertain to the group in regard to our agenda of laboratory system strengthening and viral loads scale up and the associated information around all that. So let us continue the discussion. We will be sending out these links. Please, when you get the links, visit and where you need more help, more support, the support. We want to thank the International Laboratory Branch for making all this information available to us to get to know all this. And let us take advantage of it. And I know they are available to support us, to guide us where we need guidance. But we should be more proactive to make our programs more sustainable. Otherwise, I want to thank all of us for all that we are doing. For the next few days, make sure your action plans have been captured within the country plan, and also make sure that you send us your action plan before end of this week so that we have it, and we will provide the monitoring indicators like Gesha said, but please send us the action plan which you have finalized, which you have been lobbying to get funded. Thank you very much. Luti and the International Laboratory Branch and all the stakeholders that have been working on this, thank you very much. And everybody have a great day.
Thank you. Bye-bye. Thank you, Charles.
Bye-bye. Thank you, everyone. Bye.